Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Muhammad here with us today, who flew down here from Omaha, Nebraska, for us to help him with his acid reflux and hiatal hernia that he's been dealing with over the past year. He went to see a medical doctor that prescribed him medication, of course, and he took that for a little while. It really didn't do that much and kind of had some bad side effects, so now he's not really taking the medication that much except when it gets so severe. But he's getting the acid all the way up into his esophagus, into his throat, getting the normal pressure and pain down in the lower sternum and left rib cage area here, and that sinks right around to the mid-thoracic spine region, which if you watched a number of my hiatal hernia acid reflux videos, you know that this is usually caused by a subluxation complex or misalignment of the mid-thoracic spine vertebrae, where they attach to the rib cage, which comes around and attaches to the sternum and makes the attachment for the diaphragm on the lower part of the rib cage, which is all cartilaginous in nature. So if we line up the mid-thoracic spine vertebrae, get the ribs lined up so that they have a good solid foundation for the dome or the diaphragm to hold the stomach down through into the lower part of the cavity, as opposed to the hiatus weakening because the diaphragm's tweaked because of misalignment of the ribs and vertebrae, then it slips up through there and secretes the acid into the stomach, up into the throat, and there you have acid reflux hiatal hernia. So we're going to show you how we fix that here. Let's take a look at it here, Muhammad. By the way, this is Muhammad's first visit to a chiropractor ever. Let's have you flex your head forward and backwards for me. I guess you found this on YouTube, right? Yep. Or even Google searches most of the time, hiatal hernia will pop up. We love Google. And YouTube. Right now I'm analyzing his posture three-dimensionally. So when you look in the mirror, Muhammad, do you see how your head's forward and translated off to the right like that? And your left shoulder looks a little higher. Now down here, you've got less room here on this left side than you do on the right side. Do you see that? So your pelvis and low back have shifted to the left of center on the x-axis. And here's where your ear's dropping right here over your clavicle as opposed to being back here over your shoulder. That's why your shoulders are starting to round forward a little bit and your hands are kind of out in front of you there. You notice that? Okay, so let's have you sit right here on this table and face towards Renee that way.
Do I have to take these off?
Yeah, if you don't mind. There we go. Yeah, that's probably easier, yeah. Okay, so tell me if you experience any pain in your spine anywhere when I do this. Okay, we'll go backwards down to the right. How about when I do this? Right there in the lower neck, okay. How about when we go backwards into the left? On the left side, okay. So he's got a positive foramina compression, maximum foramina compression test. Is there any pain in your neck at all when I do this?
Nope.
How about when I do this? Right there, positive shoulder depressor on the left. How about any pain there? How about when I do that? Right there, positive shoulder depressor on the right too. Okay, turn your head left for me. No, just turn, there you go. Now turn your head right. Okay, now neutral. Okay, I'm going to do a muscle test here. I'm going to pull straight down, you push straight down, you resist. Hold it up. Okay, do the same thing over here. Hold it up. Okay. Right one was a little mushy compared to the left one. Did you feel that? Okay, so I'm going to check your biceps here. I'm going to pull out, resist. Good. Now I want to reposition, test your triceps. I'm going to push you in, resist. Good. Okay, so we're going to test your bicep over here. Hold. Good. And now your triceps, I'm going to push you in. Good. Okay, let's check your reflexes here. Just relax your arm right in there. Good. Good. Doing the biceps, triceps, and brachioradialis, and now patellar reflexes. And everything is +2, equal and active. Yeah, just relax your foot right in. Good. Okay, can you just walk on your tiptoes about 3 steps that way, just to make sure you can do that. And now back towards me on your heels only. Make sure you can do that. Good. Okay. let's have you go ahead and lie on your stomach on this table. Let me change this headpiece. And it'll look like your shaved makeup. Okay, there we go. Alright. Oh boy. Your right leg is short by 3/4 of an inch. That's a lot. In the prone position. Go ahead and relax your arms right down on the side there for me. There you go. Relax them right there. Now, as I bring your legs up, I bet you that tightens up in your lower back right there.
Yep.
And your thighs. See, legs get even when I bring him up. So he does have a positive knockless test with pain in his lumbosacral spine and sacroiliac region, as well as a positive Deerfield. You've been sitting on that wallet in your right pocket all the time? For years?
Yeah.
Yeah. If you take that out of your back pocket and put it in your front, it'll probably be better. If it's a little tender right there, that's the SI joint. Yep. And L5's out right there too. Feel that one? There's L4. Now you have paraspinal muscle hypertonicity bilaterally, which means on both sides, but it's worse on this right side. You feel that tightness right there? And that's right where your lower rib cage is. Yeah, this whole right side's tighter. I'm going to push here. I want you to lock your right hand leg straight and lift that whole leg off the table. No, the whole leg. There you go. Good. Now let's do the same thing on this side. No, with this one down. Okay, try that one more time now with the right one. Put your left one down. Okay, was it more difficult on either side? Left one more so? Yeah, that's what I thought too. Okay, tender right there, big time. Ooh, those are all tender right through here though, huh? Ouch. So you got a lot of rib heads out in here. Feel that right there? And right there as well, big time. Get tight in your shoulders a lot too, don't you? Yeah, let's scoot you all the way up in there, Mom. You just relax your arms all the way down. Yeah, lower cervical spine is out on the right, C5 and C6. And he also has a atlas subluxation and occiput on the right as well. Really tender right there. See, he's got a little bit of a curvature or scoliosis right through his mid-thoracic and lower thoracic spine. You can watch my hands move right through here. He looks kind of like a snake right down through there. This is a scoliosis, which is a lateral curvature of the spine. From the A to P view, it's supposed to be straight. From the side view, you're supposed to have a curve forward in the neck, backward in the mid-back, and forward again in the lower back. Now, right now, I'm just doing some stretching, and then I'm going to adjust him. And this is your first adjustment ever, right? So we're going to start off with your sacroiliac joints. All you got to do is breathe. You get the easy job. There we go. We encourage all of our male patients who are sitting on wallets to make sure they take those wallets out and put them in their front pockets, and all the women patients who are carrying big purses on their shoulders to get rid of their shoulder purses and get one of those purses that they can wear across your chest that fits onto your hip. Just some little tips that will help you to hold your adjustments longer and not cause them to go back out of place by sitting on a wallet or carrying a purse on one shoulder all the time. Also, if you cross your legs when you sit, it's best not to cross your legs when you sit. It's better to have both feet on the floor and not slouching in your chair, of course. There we go. Okay, so let's take another look here at the leg length, and it is now even. And this should feel a little easier already, Muhammad. Yep, very good. Okay. So being Muhammad's first visit, we're going to break him in slowly here today. Get him feeling better. He's getting treated twice a day this week, so this won't be the last video you see on him. We'll do some progress updates to show you how he's doing. Let him tell you how he's doing. We always tell all of our acid reflux hiatal hernia patients when they're here that we want them to eat anything and everything that they desire, because we want to test out the hiatal hernia and the strength of the diaphragm while they're here, and make sure that we're seeing some results in not treating the hiatal hernia or acid reflux per se, but treating the underlying cause of why they have that. So if we do a good job doing that, then they won't experience the symptoms of acid reflux or hiatal hernia. GERD, which is gastroenterology, gastroenterology reflux disease, something. GERD, G-E-R-D, gastroesophageal reflux disease. There we go. I knew it was there. There, okay. Now this should feel even smoother than the previous one, Muhammad.
Mm-hmm.
Yep, good. Okay, let's turn you on your back now. Okay, just lay your head in my hands like you're sleeping. You can put your hands right there, relax. Perfect. Oh yeah, very good. I know y'all heard those. There we go. I have a lot of crack addicts, fans, that love hearing the cavitation noises of the adjustments, which is really just a nitrogen gas that explodes in the joint space when you're opening the joint space up. Now, you should have felt that in your knees and your lower back, did you?
Mm-hmm.
Okay, good. So now we're going to come around and I'm going to pull his stomach down. So take a real deep breath in for me, Muhammad. Let it all the way out. I'm going to sink my hand down in here. I'm going to grab the fundus of his stomach and I'm going to pull it down low into the lower cavity there. Okay, and another deep breath in. Let my hand just sink down in there and keep exhaling for me. There we go. And one more time. And all the way up. Keep exhaling. There. And we not only adjust the ribs in the posterior aspect, but also the front part here, or the anterior part. So let's slide all the way down on the table for me, Muhammad. A little bit more. There you go. Okay. And if you can just put your arms out like that for me. Good morning, Dr. Tristan. There we go. So I've adjusted his AC joints, which is the acromioclavicular joints. Now I'm adjusting the costosternal joints interiorly. And most hiatal hernia acid reflux sufferers suffer from a pain in the left part of the rib cage and the left lower sternum, and they're usually imbalanced in their rib cage area, and that is the case with Muhammad. You can see his right rib cage is about a half an inch lower than his left rib cage. Can you feel that at all? Okay. So, along with that's coming from the curvature scoliosis in your spine. That's why that's different. And then, see, that's making your diaphragm not be strong and stable to hold your stomach down there. So we're going to correct your misalignments in your thoracic spine, realign the rib cage with it, and then that should hold your stomach down. So let's sit you up face towards Renee here for a second. There we go. Good. Okay. Good. Perfect. Get your elbows here too. Just relax. How's the weather in Omaha right now?
Oh, very cold.
Cold? Yeah.
Snow on the ground.
Oh, it got snow, huh?
Yep.
So you're along with a lot of the rest of the country and getting snow. That's the one thing we don't see too much up here in Houston, snow and ice. Occasionally, a couple winters ago we had some. Okay, now let's come over here in front of the mirror. I'm not going to decompress him on his very first adjustment this morning. I'll do that probably this evening. Okay, I'm going to have you close your eyes again, Muhammad, and flex your head forward and then backwards again. And then back to neutral. Okay, now take a look in the mirror. So your head's up and back more now. Your hands are more at your sides than they were out front. But still, this is going to be your homework here. You're going to lift your shoulders up, pull them back, clear these guys way back here. See how it tightens up your whole trap? Then we're going to bring your head straight back in the Z-axis. Because yours is translated to the right, we're going to do exactly the opposite of that. And because your scoliosis down here, I'm going to tilt you left. Okay, shift your pelvis straight out to the right now, because it was left too, like this. Straight out to, there you go. Okay, hold that right there for me. I'm adjusting his atlas right now on the X-axis with him in a mirror image. Excellent. Okay, now you can relax. Let's try that very same thing again. Flex your head forward and then backwards for me. And then back to neutral. Much better, actually. Take a look now. See how we opened up the space here? And now your head's set more in the center than it was before. But you can tell where that curvature is here because your scapula is sticking out more here on the right than it is the left. Have you ever noticed that when you're sitting?
Yep.
Yep. Okay. So how's that feel right now?
Good.
Good.
Yep.
All right. So this is the very first treatment of Muhammad, who has never had chiropractic care before in his life, and he's here because he's been suffering from acid reflux, hiatal hernia. So this is your Houston chiropractor from Advanced Chiropractic Relief in Houston, Texas with Muhammad today, and we'll see you next time.